Well, the CDC is constantly learning more about the illness, and as the result, the guidelines often evolve.
Like they did today. To keep up with the current guidelines tonight, East Texas first responders are learning what to do and what not to do. CBS 19's Katira Winfrey is live in our studio now.
Yeah, Katira, EMS and paramedics could be the first people to come in contact with a person with Ebola, and that changes some of the rules.
Absolutely, Dana, it does. And here in East Texas, there's been a daily effort to evaluate every aspect of first response in light of the Ebola cases in Dallas. In some cases, that means tweaking and even rethinking their procedures and protocols. Bringing agencies together at TJC tonight was an important step.
This is a scare that we have to be aware of, and this training will provide that.
When it comes to the Ebola threat, the doctors, nurses, EMS workers, and firefighters we look to keep us well are often the most at risk. What they do when they get on scene of a potential Ebola case lays the foundation on keeping the illness from spreading. But knowing what to do requires training.
How to protect the first responders, how to protect the firefighters, because a lot of times we're first on scene, and what to do for EMS when they get there so we can relay the information.
About 50 first responders across Smith County came together to learn more about the Ebola operational plan. ETMC representatives broke down the plan.
We want people to understand that we have it. We've got it together.
The goal of this course is to make sure responders across the area are on the same page of understanding how to assess a case. Does the patient have a fever of 101.5 or higher with headache, muscle pain, or nausea? In the past 21 days, have they been to any of the West African countries affected? Have they had contact with the blood or bodily fluid of someone with Ebola? From there, the need to don protective gear is decided.
Especially when you take it off, we want to make sure that you take it off carefully and correctly, because that's when you may actually have contamination on it.
The gear first responders wear isn't as cumbersome as doctors or nurses would wear in a hospital, but it's equally important.
The issue, and so we have a lot of fear out there, and we're trying to subdue that fear.
And we found this interesting. When it comes to dealing with potential Ebola cases, first responders have to reprogram their thinking and actually slow down. Medical experts say when workers are moving too fast, the likelihood of making a mistake while putting on or taking off safety gear, it goes up.
Hey, Katira, how often do the medical workers get updates on Ebola guidelines?
Well, they actually have to. It's actually the CDC holds conference calls every week, and medical workers and first responders are able to patch in to get the latest updates and learn the best procedures.
Thank you, Katira. And now the flu season is here. Medical workers are expected to be even more on guard because the symptoms of the flu can be similar to Ebola symptoms.
So if you notice you have a high temperature with headaches, nausea, or vomiting, keep yourself isolated and call for medical help. You can find more information about Ebola on our website, cbs19.tv. Click on the hot button.